So most of you have probably never even heard of H. pylori, and ironically, it's the #1 cause of stomach ulcers and stomach cancer. We thought stress, but nope, it's H. pylori. So what on the world is H. pylori? H. pylori is a pathogenic bacteria. You get it primarily from swapping spit with someone who's been infected with it. And it's very, very common, way more common than we've ever realized. Upwards of 50% of the general population may be infected with H. pylori. So sharing a glass of water, kissing your significant other, even having your dog give you kisses could transfer H. pylori. Now, what is the significance of having an H. pylori infection? Well, the problem is it damages the parietal cells of the stomach. Parietal cells are responsible for producing transfer factor as well as hydrochloric acid. Both of these things are very, very important for optimizing protein digestion, for increasing absorption of vitamin B12, and also optimizing the pH of the stomach to help absorb minerals such as calcium and magnesium more effectively once they enter the digestive tract. Now, the best way to test, or how do you actually test for H. pylori traditionally, would be an antibody breath test or an antibody blood test. Now, the problem with both of these tests are they have a high rate of false negatives. And how can that be? Well, if you've had a chronic low-grade H. pylori infection with very little symptoms, for instance, your antibody response could actually burn out, which means it would come up as negative even though you're running a chronic infection. So the best way to test would actually be with a stool antibody test. It's proof positive that you have an infection. Once you find out that you have an infection, you should work with your MD or your practitioner to look and investigate at the various different treatment options you have. Now, it's very important once you get rid of H. pylori to make sure that you heal the damage from H. pylori. Make sure that you look at your B12 levels, which could be compromised, your protein absorption, as well as your hydrochloric acid levels. Now, one last thing to note is because it's easy to swap with someone, your significant other, through saliva, you need to make sure that you have your family members tested or anyone that you're sharing meals with and or swapping spit with to ensure that they don't have it and you don't get reinfected. I find commonly that clients get reinfected with this pathogenic bacteria without even realizing it. So make sure you work with your practitioner to explore your treatment options, to work on healing and getting onto the road to recovery.